Burnout and occupational stress among healthcare workers are increasingly being recognized as significant threats to patient safety and care quality. Registered nurses in the United States working in nursing homes report higher rates of burnout and job dissatisfaction than RNs employed in any other settings, including hospitals. Yet, little is known about how this impacts care quality. A 2014 Department of Health and Human Services Office of Inspector General reports found that roughly 1 in 5 Medicare beneficiaries receiving post-acute care in nursing homes from 2008 to 2012 experienced adverse events, resulting in harm. Just over 2/3 of these events were classified as preventable due to inadequate monitoring, failure to provide necessary treatments, substandard treatments, or inadequate, incomplete care plans. Burnout among hospital RNs has been identified as an important mediator in the relationship between work environment and patient safety outcomes. Studies of missed care in nursing homes have been done primarily outside of the United States, with samples composed largely of nursing assistants rather than licensed nurses. These studies have shown that lower staffing, poor teamwork, and safety climate, higher work stress, and increased resident acuity contribute to missed care, and that nursing staff who miss care are more likely to experience emotional exhaustion and rate care quality poorly. Staffing and resource adequacy, supportive managers' compensation, RN engagement in organization affairs, and promotional opportunities have been found to contribute to RN job satisfaction in the U.S. nursing homes. Yet, there is still poor understanding as to how job satisfaction and burnout relate to patient safety in these settings. In this study, we explore an element of this relationship by examining how burnout and job dissatisfaction contribute to the likelihood of nursing home RNs and necessary care. This study hypothesized that both burnout and job dissatisfaction would be associated with greater likelihood of missed care. Our objective to the study is to examine the relationship between the RN burnout, job dissatisfaction, and missed care in nursing homes.
For the method in this journal article, design study was cross-sectional secondary analysis of 2015 RN forecast U.S. nursing survey data from California, Florida, New Jersey, and Pennsylvania. In setting, they surveyed 30% random sample of licensed RNs in each of 4 states, a total of 231,000 RNs using mail and email address on file with the State Board of Nursing. Of the parent survey respondent, 2.6% or 1,540 RNs work in the nursing home, a similar proportion to that of RNs employed in nursing home across the United States. Participant. The study included only RNs who specifically report their positions as direct care, yielding a final sample of 687 direct care RNs employed across the 540 nursing homes. For the measurement, there are emotional exhaustion subscale, mass/burnout inventory, job dissatisfactions, and missed care. So burnout. Burnout was measured using emotional exhaustion subscale of mass/burnout inventory, a validated standardized tool for assessing occupational burnout. Nurses indicate how frequently they experience 9 feelings of emotional exhaustion using 7-point scale. Job dissatisfactions. Nurses reported the degree to which they were satisfied with their primary job using 4-point scale, range from very satisfied to very dissatisfied. Missed care. The nurses were asked to identify from a list of 14 care activities which, if any, were necessary but left undone due to lack of time or resources on their most recent shift or day worked.
Result: across all RNs, 31% were dissatisfied with their jobs and 30% exhibited burnout. Miscare rates were significantly higher for RNs with job dissatisfaction and burnout. 72% reported missing one or more care tasks on their last shift due to lack of time or resources. By contrast, 83% of RNs with job dissatisfaction and 95% of RNs with burnout reported missing care. Across all activities, RNs with burnout were more likely to leave care undone. The activity most often missed was comforting, talking with patients, which 50% of total sample, 64% of RNs with job dissatisfaction, and 77% of RNs with burnout reported leaving undone. "42% of RNs with burnout and 34% of RNs with job dissatisfaction reported frequently being unable to complete necessary care, compared to 20% of the overall sample. RNs with burnout were 5 times more likely to leave necessary care undone than RNs without burnout, while the nurses who were dissatisfied with their jobs were 2.6 times more likely to leave necessary care undone than the ones who were satisfied. Extensive evidence has shown that RNs are more satisfied and experience less burnout when they have adequate staff and resources, supportive managers, productive colleague relationships, input into organizational affairs, and opportunities for advancement.
Limitations. The cross-sectional design of the study prevents us from drawing conclusions as to causal relationship between our variable of interest. There are more than 15,000 nursing homes in the United States, 45 which may limit generalizability of our finding, although our samples still include hundreds of RNs employed across 540 nursing homes in 4 states. Finally, by excluding RNs in administrative roles, we lost more than half of our original sample of survey respondents from our analysis.
So the takeaway for our discussions from this study is that findings from this study indicates that nursing home RNs are often unable to complete needed nursing care due to inadequate time or resources, and the miscare is more common among RNs with high burnout or job dissatisfaction. 1 in 5 RNs in our sample reported frequently being unable to complete necessary patient care. In our study, 33% of the RNs with burnouts and 25% of the RNs with job dissatisfaction said they were unable to administer medications on time, which is a key aspect of medication safety. Work environment that provide adequate staff and resources involve RNs in quality improvement processes and support nurses throughout their career pathways and leadership opportunities could help to promote employee engagement, reduce miscare, and improve patient safety in nursing homes.